Tonight, blood plasma from people who have recovered from coronavirus is in high demand. The plasma contains antibodies that may be used for research or to help the most critically ill fight off the infection. I spoke earlier with someone who recently donated their plasma. Desert AIDS Project's infectious disease specialist, Dr. Taluka Singh. Dr. Singh, thanks for joining us.
Thank you for having me.
Tell us about your experience donating plasma for research.
So I had COVID in March and I got my antibody results later and they were positive. So since I had gotten over the active infection and now had antibodies, IgG, in my system, I qualified for donating plasma. Plasma is a life-saving solution to the enormity of this pandemic that's going on and getting people admitted in the hospitals, intubated in the ICUs. So I decided to donate the plasma, and I decided to go with the Livestream company. They are local, available, and I did some research and found that their process online was quite simple and pretty easy to follow, user-friendly process. So I went on their website and I answered the preliminary questions, which qualified me to get to the next level, where one of their nurses reviewed my information. That included providing them with the results of the testing to show that I did have COVID. And I got a call back from them immediately, actually, the same day that I submitted online. It was just, it felt special. It felt like I was doing something that I wish I had done earlier. It was my first time giving plasma. And they actually, once you donate any blood or any plasma for the first time, they give you a little bowl and they put it on your arm after you're done. And it was like a cute touch. It was kind of nice. And they made me feel very comfortable. They had heating pad, they had cooling blankets, they had, anything that you wanted. They gave you water, snacks, whatever you want. Overall, I would say it was a great experience. They did say that they sent my plasma to St. Bernardine Medical Center, and they hoped that they could save 1 to 2 patients with that plasma donation. And they asked me when I can donate again. So I was like, how early can I donate? They're like, we can take your plasma every week if you like. I was like, okay, all right, let me think about it. And then I'm hoping to go back and do this again.
So you had a very positive experience. How is the research being used here in the Coachella Valley?
So research in Desert Regional, the infectious disease doctors there are doing plasma COVID research. So they're checking if the plasma, after they give the plasma to the patient, how early and how it's cutting down the hospitalization. Patients are getting extubated earlier than when they didn't get the plasma. So there's a lot of plasma research going on, and so far it's showing very good results, and it shows that plasma actually works, and that's why there's such a high demand and such an interest in plasma to help patients until we get better medications for it.
What was your experience like with coronavirus? Do you know where you got it from?
I was working taking care of patients, and they were sick and they had upper respiratory symptoms, and maybe it was that, or maybe it was just out in the community. I mean, you can get COVID if you're in a grocery store and there are droplets there. So it could have been anywhere.
How severe were your symptoms?
So I would say my symptoms lasted about 3 days. My main symptom was severe fatigue. I'm a very high energetic person. I go work out and I just felt very run down. And I was like, oh, maybe I'm just tired from work. But I never get that tired that I have to go home and take a nap. And I went home after a day's work and took a nap, and this nap just became like a 6-hour thing. I woke up suddenly at 10 o'clock in the night, and I was like, oh, the whole evening went by, and I didn't realize I wasn't hungry or anything. I had loss of appetite. There were chills. I was sweating. I took my temperature. I didn't have a fever. I didn't have upper respiratory symptoms either. It was very atypical. But in the next couple of days, I did notice there was a lack of sense of smell and taste, which I thought was my cooking, that I couldn't taste much. But I was told that I am a very aromatherapy person, and I got on this beautiful smelling candle and I couldn't smell it.
Are you worried you could get the virus again?
Yes, I can get it again, but hopefully with the antibodies that I do have, it'll be able to fight it better and I'll have even less symptoms.
All right. Dr. Singh, we appreciate your time. Thanks for joining us.
Thank you. Face masking helps. So keep on doing that. Take care.